A very warm welcome. Today we have with us Mr. Abhirup Bhattacharjee, who is the head IT at Charan Diabetes Institute Hospital. A very warm welcome, sir. Thank you for joining at CXO TV.
Thank you very much. But thanks for
Thank you, sir. Industry. So when it comes to healthcare institutions, we would love to understand your perspective that how has the role of IT evolved in this healthcare institutions and what exactly the impact has it have upon the patients, the patient care and the administrative process, if you can share some insights around it.
Nowadays, I think the healthcare information technology is playing a very key role in this hospital, and it is also a healthcare information technology is also an important part of the information technology also, because a lot of IT companies are designing a lot of healthcare solutions to support the hospital to give some better outcome to the patient, to properly to digitize the system of this hospital. So I'll say it has evolved a lot. It has evolved very rapidly since last few years. Because in perspective, if you see the electronic medical record part, that is the EHR part, electronic health record part. So one of the significant achievements in healthcare is the adoption of the hospital information system in all the hospitals. So earlier, actually, a lot of doctors, a lot of healthcare providers are not using the system so much. But since the last few years, a lot of doctors, a lot of healthcare providers have understood the importance of using this system. Hence, the adoption has increased quite a lot in all this hospital, because the doctors have understood that how it has improved the patient outcomes, how it has helped them to treat the patient in a more better way. If they can see the history of, suppose a patient is coming for follow-up since last few years. So doctors can see all the past history, all the trend of investigations in the EHR, in the EMR. So it is helping the doctors a lot. So the adoption has increased actually.
All right. So,
Yeah.
please tell.
Yeah, and another thing is all see a lot of data analytics also in this sector. People have done, because as we also have the research wing, so we are mainly focused on diabetes and all. So we have a lot of data with us with the diabetes patients. So we do a lot of analytics on those the data to give to generate some proper treatment method and proper treatment outcome for all the patients. So which is benefiting the patients a lot.
Okay. So when we are talking about healthcare sector, especially, I think the amount of technological adoption that has happened, it's more during the times of COVID-19 pandemic, which has actually accelerated the adoption of telehealth and remote patient monitoring. So with that aspect, what benefits and challenges have you observed in their implementation of such kind of remote work culture in the tele health sector?
See, any new thing, if you implement in any kind of organization, there are some the challenges are there, but it has benefited a lot to the patient during the COVID time. So whenever we have implemented that telemedicine solution in the COVID era, so initially a lot of people were not so much trained about that, and a lot of people are not used to. A lot of doctors are not used to of that type of consultation. So those training and to make them aware of the system, there were some challenges over there in initially. Second challenge, I will say that internet connectivity, because in India, see, in all areas there are not proper internet connectivity is there. So if the doctor is able to hear the patient properly, so then he is not in a position to give the patient a correct treatment and correct diagnosis and medications. So this challenges we have faced. Another one we have faced that patients are not able to upload that because patients are also new in this telemedicine because they are more used to of this physical consultation and all.
Absolutely.
If they are conversing in telemedicine platforms, so they are not so much comfortable and they are not able to also upload their reports and all. So for these are some of the challenges we face, but later on, slowly it has streamlined actually. In the
Right.
but it has benefited a lot because lot of I would say that a lot of follow-up patients who don't have to come to the in hospital to just show the report. So they can
Absolutely. Yeah.
they can do the consultation on telemedicine, which is a great help for them actually.
Correct. I think it has given a lot of convenience, as you mentioned. And at the same time, there are challenges. It's more about awareness to bring forward, and network connectivity is again definitely an issue to pull this up. When again, at the same time, when we talk about interoperability, is again a challenge when we are mentioning about it in the healthcare IT. So, how do hospitals address the interoperability of systems and data exchange to ensure a seamless communication between different healthcare platforms?
See, in hospital, the interoperability, it has taken some shape because, see, if you say the standards, a lot of standards has come to the healthcare industry. To say HIPAA is there, then in India also one like it's similar to HIPAA, Disha. Disha, I hope you have heard about that.
Yes.
Disha is the guidelines and Disha is in, I think it is a proposed one. But still now it is not approved. But Disha is similar to HIPAA and a lot of, and this interoperability, if you go on this, suppose those lab equipments are there and all those they are having different kind of softwares. So that HL7 has played a big role in that interoperability in any kind of radiology equipment, suppose X-ray, MRI, CT scan, supposing lab equipment. So HL7 has played a big role in the interoperability. So which has helped us a lot for the integration part actually. Second one is that this a lot of APIs are there. So application program interface, a lot of APIs. So if we are using, suppose we are using the CRM kind of software for the patient management. So we are also using hospital information system. So there are APIs through which we can make the software speak to each other. So APIs has also played a big role in the interoperability part.
Okay. Coming to a different segment, which is more about healthcare data. It has been a very crucial thing with increasing digitization of patient record and this sensitive medical data that we have. Data security has been a paramount concern. So, how do healthcare organizations approach data security to absolutely ensure that the patient's privacy and compliance with healthcare regulation is again secured?
Data security is one of the top priority of the healthcare organization nowadays.
Okay.
So we implement a lot of softwares to keep our systems protective. Suppose I hope you have heard about all those EDR and XDR solution. Lots of
Right.
the firewalls are there. So through that, we try to keep our network very safe and secure. And a lot of things like encryption also, a lot of whenever we are doing some exchange between the softwares and we are doing some exchange of data with the third party, so we place some encryption level of thing, which helps us to secure that transition of data in a proper way. And also access controls, a lot of users, there was proper nursing will have the access of only that much of data which is assigned to them. So as per the user roles also, we have tried to minimize the excess of data to all the employees.
Okay.
Also, there are some audit trails are also there. See, in my software, all whichever user has done there. So entire audit trail is there. Suppose if doctor has done some consultation, it has been edited by some other doctor, if it is allowed. So that editing entire audit trail is there. So that in any kind of audit or any kind of court case and all, so we can find out who has done it. So proper audit if we try to maintain in the software.
Okay. Okay. So when it comes to engaging with patient, I think the amount of revolution that has taken in the healthcare industry or the sector is incredible. So engaging with patients in this healthcare journey has been a crucial thing. So what kind of technologies or strategies do you suggest to enhance this patients' engagement and empower the individuals to actively participate in their health management?
See, I would say there are a lot of softwares and a lot of platforms through which we can keep in touch with the patient. So, but say that every hospital is in nowadays patient portal and all is there. So,
Right.
patient portal, if you put the unique ID of the patient can access his or her records anytime. So, patient portal of every hospital is playing a great role in that. Another thing is that suppose there are a lot of mobile apps are there. Suppose Hindi5B and all those, there are a lot of companies that just come up with a lot of mobile app there. So if the patient is serious, they can put the data and all into the app. So which can be monitored by them as hospital staff or the care provider to track and to keep to track the patient and to monitor the patient in a proper way. Another advanced technology, I would say, this for that remote patient monitoring part. If you have heard about this CGM, continuous glucose monitoring, so in the diabetes, we provide the patient with CGM devices, so which needs to be fixed to the patient body. So through the CGM device, the patient can be monitored from our hospital to what is the condition, what is the sugar level of the patient. See if the level is dropping or it is getting high, so immediately we communicate to the patient that your blood sugar levels are getting high. So all this kind of solution has, I think, helped to remotely to monitor the patient in a better way.
I think absolutely it has it enhanced the process completely. And when we talk about technological adaptation, maybe AI or IoT, these are the several emerging technologies which are actually making way into this healthcare industry. And so, in that aspect, how do you see that the healthcare institutions leverage these technologies, and what kind of impact do you foresee when it comes to the improving of the diagnostics, treatment, and also patient outcomes?
In diagnostic, I would say radiology part, which is there, AI, artificial intelligence is helping a lot because to find out the comparison of images and to find out the behavior of the suppose the radiologist is helping us to find out the diagnosis. But in some cases, in some hospitals, people also try that in the absence of radiologist also, a lot of findings can be find out through the if AI is help. I will say it is AI is not giving the output, but AI is helping the radiologist to give the proper report to find the proper findings,
With accuracy.
accuracy, and it is in accuracy of the report, I will say.
Okay.
And if you see the chatbots, there are different kinds of chatbots are there, right, on the hospital websites and all. So through chatbots, AI is helping a lot to suppose patient can have different type of queries about his disease, and so they through chatbots and all they can get a lot of information which is helping them to uh, keep them healthy and to take the medicines in
Right decision.
yeah.
Yeah.
Okay.
So, right. Absolutely. So when it comes to, what do you think that would be the top focus areas or the priorities that would be in line over the next 3 to 5 years to come by?
The top priorities, if you ask me, I would say that this early detection and prevention is one of the important factors. And another part is that precision medicine is going to play a major role in the coming days. And data-driven insights are the most important thing, which are going to whether the treatment outcome will improve a lot actually. And also the cost reduction and reduction in this hospital is the most important part. Cost reduction and also the better the treatment of patient. So again, all those things are mainly the focus areas. You were asking about the technologies or just
Well, I was about to put that forward since you were talking in a generic way. So, in terms of the tech focus areas, what do you think would be the priorities in the healthcare sector?
see artificial intelligence will definitely it will help. A lot of devices are now. So what I told you that we are using this CGM devices and all. So this kind of wearable devices through which patient can be monitored 24 hours. So all these kind of technologies are important. Also, the precision medicine is one of the important factor which can help the clinicians. I think all those things is a
Okay.
way to play.
Okay.
Yeah.
Right. So when it comes to the future outlook, as you mentioned that AI and cloud is again a part of the transformation that is happening or the digitization that is happening in the healthcare sector. So what exactly is your future outlook for the healthcare industry, and what are the technologies which will be crucial for the growth of this sector?
The technology, if you ask with the main is interoperability and the data exchange, because
Okay.
if we are doing a transfer with any other software or if we are exchanging information with some other healthcare organizations, interoperability and data exchange is one of the most. With telehealth, we need to improve a lot actually because it can help. At AI and machine learning integration is definitely required in the softwares which are being used at the
Right.
cyber security and data privacy is one of the also main factor which a lot of spending needs to be required in the coming 4 to 5 years.
Absolutely.
So all those kind of things, I think it is like
Okay. Okay, all right, sir. Thank you. With this, we have come to the end of this discussion. It has been really an engaging one. And as you mentioned, with AI and cybersecurity, with ML, the industry is going to bloom further. We look forward to more such discussion in future. Thank you for joining once again at CXO.
For more updates from CXO TV, please like and subscribe to our channel.